Now we're moving to the next concentration. We're going to be looking at blood changes in neonatal sepsis. Alright, so you can see these characteristics, rashes, or you could say petechiae, is because of what? A widespread bloodstream infection, that's sepsis, right? So we are quickly trying to look at this. So for blood changes in neonatal sepsis, you can also say hematological changes. Okay, so we said that sepsis in generally, of course, it triggers what? A cascade of what? Hematological changes. So your body, your blood is trying to fight an infection that is in the bloodstream. You understand? So this can be dictated through blood tests, all right, and it's very crucial. You making blood tests for a patient that has sepsis is very important for you to be able to even know whether the disease is there or not. Okay, so for blood changes in neonatal sepsis, of course, white blood cells, the levels are altering. All right, maybe in early stages of the disease, the levels can be so high to fight the disease, but later on the levels is going down. You understand? Probably there's like a destruction of the white blood cells. Neutrophilia or neutropenia, neutrophil levels can go up or go down. All right, left shift. So you see there's like increment in the production of neutrophils so that they can be able to fight infection. So if you do a blood smear, in the peripheral blood smear, you see a lot of what? Immature neutrophils. So morphological changes, toxic granulation, vacuolization, dull bodies will be found in neutrophils. Okay, and if you see that, that's like a potent confirmation that there's a widespread inflammation or widespread infection in the bloodstream that the body is trying to fight. Okay, so for platelets, platelets levels are going down. So there's thrombocytopenia. So this person can be prone to bleeding. All right, the platelet morphology is also changing, have abnormal shapes here and there. Then for red blood cell changes, anemia. So red blood cell levels are basically going down. Okay, so we can have a pneumocytic, pneumochromic anemia, okay, which may result from breakdown of red blood cell, that's hemolysis. Okay, or sometimes the bone marrow, the way the bone marrow is supposed to be functioning, is kind of like suppressed. Then you see a lot of inflammatory markers in the system, like C-reactive proteins, procalcitonin, erythrocyte sedimentation rate is also increased. Okay, so other diagnostic indicators is you use things like the hematological scoring system, which we'll look at it. That one basically focus on what? The changes in the cell count of different blood cells. Then also you can use blood cultures, where you are taking some samples, you are keeping it in the lab so that it will grow and you can be able to pinpoint the organism that is causing the issue in the patient. So by and large, these are the different changes in your blood. If that's in the blood of a newborn, if they have an infection, they are actually trying to fight that.